Welcome to the Beverly Hills Plastic Surgery Podcast. Dr. Jay Calvert sitting here on a Saturday with Dr. Millicent Ravello. How are you doing, Dr. Ravello?
I'm doing fabulous. How are you?
I'm doing great. This is a very important podcast that we're going to do right now because it's something that I've been involved with my whole career. And it's about diced cartilage and fascia grafts for the nose.
DCF.
DCF, that's right. Now, the history of this is pretty interesting. Diced cartilage and fascia was something that I got involved in out of, right into my career. I wound up coming out to the UC Irvine faculty right out of my residency, my first job. So I left the University of Pittsburgh, come out to UCI, and I called up Roland Daniel, who is a very famous nasal surgeon.
Yes.
And I said, I'm trying to learn rhinoplasty. You mind if I come hang out for a little bit? And he said, sure, come on down to the Newport Beach Surgery Center. And he and I started talking about research. And I said, well, I got this lab, and I'm trying to look for things to do. And he says, oh, well, I have a problem. So I am 20 for 20 for the first time ever in my rhinoplasty career. I did 20 diced cartilage and Surgicel grafts, also known as the Turkish Delight, and all of them failed completely.
So first of all, 20 for 20 is a lot. That's a lot of preservation. I would have hit 5 and been like, stocks.
It took a while for him to realize that they failed. It took 6 months.
Okay.
And, Roland does
fair.
things. He does so much. When he was doing rhinoplasty, he was doing numbers that were insane. So if he decided he was going to do something, it was boom,
okay.
20 we're done.
Yeah, in a month, he probably did 20. That's fair.
That's true.
Okay, so let's break down those words that you just said. What is diced cartilage? What is Surgicel?
Okay, so diced cartilage is the concept that you can take cartilage and dice it up into little pieces and then wrap it like a burrito or a
Turkish Delight.
Or a Turkish Delight candy, which is delicious, by the way. And it was named by owner Errol, the Turkish Delight, because that's a candy that people love. It's a delicious treat. But he would dice up the cartilage, wrap it in Surgicel, which is a off-the-shelf, man-made anti-bleeding device. It's a clotting device, basically. It looks like a little piece of material. And it's made out of oxidized methylcellulose, which will become relevant in a few minutes. But he was wrapping up this diced cartilage in Surgicel and putting it on the bridge to smooth out the bridge of the nose, to cover and camouflage and build any little irregularities into a smooth bridge. And he reported 1,200 grafts or something crazy like that, and said it worked every time, and it was a home run. So Roland went,
okay,
sounds like a good idea. Owner's a skilled guy. I'm a skilled guy. I'm going to try it. So he tried it, and all of it just dissipated and went away. Now, later on down the road, we figured out that Owner was not using diced cartilage and Surgicel as a method of building the bridge. He was using it as a way of camouflage.
Totally different.
Roland was really trying to build radix grafts and things like that with it, and it wasn't working. And as a young neophyte plastic surgeon who just arrived from the University of Pittsburgh, and what I considered myself to be a hack polymer chemist from my patent on caprotite and several other things that I did, I said, well, oxidized methylcellulose is going to kill the cartilage. Why would you use that? And he goes, what do you mean it's going to kill the cartilage? I said, it's going to absorb by foreign body reaction or inflammatory response or something bad. And I don't think the cartilage is going to survive. He goes, that's interesting. I go, well, why don't you wrap it up in fascia, since you're always talking about that? Because I'd done all of Roland's courses at ASPS, and he's always talking about taking fascia grafts and making radix grafts out of it. So I just said, Roland, you're always talking about taking that fascia, dice up the cartilage, wrap it in fascia, put it in. And he goes, all right. He goes, I'm going to go back on all these. He goes, how about I get some of the tissue? We'll get the tissue and see what happened to my DCS, the diced cartilage and Surgicel grafts. I'll put in a diced cartilage and fascia graft, and then if it works, we'll write a paper.
And fascia is basically just the covering of the muscle.
Right.
Just for definition terms.
Right. Fascia, for those of you playing at home, is basically from the temporal region. Right over the side of the head, there's a muscle called the temporalis. And you can Google that one. You can see where this is. And you make a small cut over the ear, get down onto the temporalis fascia, and you take a piece of it,